Hi, and welcome everyone. Good afternoon and good morning, depending on where you are joining from. We're so excited to get started today. As you make your way into this webinar, please use that chat feature to introduce yourself. We'd love to know your name, where you are coming from today, and your roles. Um, we have a topic that I think is going to be a great one. We're going to be diving into some of the strategies that schools can use to support mental health and behavioral wellness throughout schools. We have some research that we're going to be diving into. We'll share a little bit of background information on some data that Move This World and Presence has collected. And then we are going to hear from our amazing team of leaders that we have present here today that I will be introducing you all to shortly. Before we dive into introductions, a couple of quick housekeeping items. We are going to be recording this session and sharing it out afterwards. So if you have to hop off early or know someone that was unable to make it, rest assured we will be sharing that recording. We will also be using both the chat and the Q&A feature. So if you have any reflections that you want to share or questions, please use those tools to do so. The Q&A is great for questions. We'll try and save some time at the end to share them out with the audience, as well as go through as many as we can. And I'm seeing some chats coming through. So we have folks from all over the country. I'm seeing Connecticut, Salt Lake City, Chicago. We have Vermont here, New Jersey, California. We're all across the map. Tennessee. Wonderful. Well, thank you. Continue to introduce yourself, and we will transition into some introductions to our panelists. So my name is Kendall Sweeney. I am the Senior Director of Impact at Move This World. If you attended our webinar in December, I had the opportunity and privilege to be a part of that discussion. Today, we have a different set of panelists who I will introduce you to now. First, we have Jolise Galarza, who joins us from IDEA Public Schools, where she is the Director of Mental Health and SEL. Jolise has been in the field of school social work for 8 years and continues her social work journey, working as the National Director of Mental Health and SEL at IDEA Public Schools, serving over 140 schools and over 80,000 students and families across the district. Part-time, she is the clinical director for the Purple Couch in San Antonio, Texas, supporting clinical operations while also supervising interns and associates. She began her career as the founding social worker of IDEA Walden Public Schools in 2019, and presently she is on track to obtain her DSW from the University of Kentucky in 2025, and she continues to advocate for youth and families within the education system. Sarah Potler-Lahane is the founder and CEO of Move This World, a proactive and preventative mental health platform for students, staff, and families in pre-K through 12th grade. A lifelong dancer and former professional performer, Sarah Lahane authored, implemented, and evaluated the original Move This World curriculum 15 years ago as a Fulbright Scholar in Bogota, Colombia. She has presented at conferences across 5 continents and has been featured in CNN, Forbes, The Washington Post, The Wall Street Journal, The Guardian, ABC7, The Atlantic, USA Today, Today Parenting, and more. Move This World's evidence-based results have impacted the lives of over 4 million students across 45 states and 9 countries. And finally, we have Kate Everly Walker, who joins us as the CEO of Presence, a leading provider of pre-K through 12th grade remote special education, mental health evaluation, and teletherapy services. Kate is an education industry leader, author, and working mom with more than 20 years of experience leading high-profile education companies. Prior to coming to Presence in 2019, Kate was the CEO of the Princeton Review and Tutor.com. She also led corporate strategy for Kaplan Incorporated and has served on several education-focused boards. Kate is the author of the book, The Good Boss, 9 Ways Every Manager Can Support Women at Work, and she lives in Brooklyn with her husband and their 2 daughters. So welcome to our amazing panelists. And for some background on the organizations that we have represented here today, you're going to be hearing a lot more about each of these. But quickly, we wanted to just provide some brief context on each organization. So Idea Public Schools, where Jolise joins us from, is a large school district. They have 145 schools across 11 regions and 4 states, and they support 87,000 students. Their mission is to transform education by preparing graduates to succeed in college and life, and they believe that each and every child can go to college. They've also done some incredible work to support the mental health needs of students. This year, they've had over 178,525 direct mental health services provided to students and over 2,110,000 minutes towards direct mental health services provided to those students. So really incredible impact that they've had on their communities. Presence is the leader in pre-K through 12th grade teletherapy. They're innovating how schools assess and address student special education and mental health needs. With over 7 million teletherapy sessions and remote evaluations delivered, and nearly 10,000 pre-K through 12th grade schools supported across the country, schools really look to the experience and expertise of Presence. And they've been doing so since 2009. And finally, Move This World works with students, educators, schools, families across the country to support proactive and preventative mental health outcomes for pre-K through 12th grade. The program is designed to prioritize ease of use. So through participatory multimedia experiences, classrooms can access content that builds a common language to support students with their proactive mental health. All right. So, if you have joined a webinar with Move This World before, you might be familiar with the fact that we like to kick things off with a quick opening or centering exercise. So we are going to do just that through a quick discovery drawing. So I invite everyone that is here today to grab a sheet of paper. It can be a scrap paper, the back of a napkin, anything that you have handy, and something to write with. And we are going to just do a quick reflection before we dive into the content. The way that this is going to work is I will read 3 different prompts one at a time. After each prompt, I'm going to invite you to take 30 seconds to create a quick drawing that represents your response to that prompt. Now, this drawing is meant to be open-ended. It can be as literal or as abstract as you'd like to make it. There's no right or wrong way to do this. So we will get started. Our first prompt is, what does the dream or ideal state of mental and behavioral health look and feel like in your school community? So we'll take about 30 seconds and you can create a drawing that represents your response to that. All right, time is up. I know that went by quite quickly, but we are going to move on to our next prompt, which is, what does the current state of mental and behavioral health look and feel like in your school community? So same thing here, we'll take about 30 seconds. Time is up. So we'll move to our third and final prompt, which is what is missing or what do you need in order to get from the current to dream and ideal state? It'll take about 30 seconds. All right. So you can wrap up any final details on those drawings. And I'm going to invite each of you to take a moment and look at the drawings that you've created. Take notice of anything that stands out, any trends, anything that may surprise you. And I'm going to invite you to share any of those reactions or reflections in the chat. And while you're doing that, I want to turn it over to our panelists and offer you the opportunity to also share. And I'm curious from each of your perspectives, how your drawings may speak to what you've seen in recent years when it comes to mental and behavioral health. And Jolise, we'll start with you.
Drawing is not my forte, so I did draw stick figures. But when we talk about kind of like the dream or ideal state, I did draw a stick figure, a student in the middle, and then just others around that student. I think the ideal state is just the collaborative partnerships with the districts at all levels, right? That includes like community partnerships, our families, our teachers, our district level leaders. So that wrap around like full collaborative support. I think right now in the current state, I did put like a student stick figure and then two other stick figures representative of school counselors and social workers, because oftentimes they're the most relied on and the ones who are truly involved, when it should look more of like in the missing piece, like a more collaborative approach that is done through just continued advocacy and collaborative partnership that is consistent.
Great, thank you. And Sarah and Kate, would either of you like to share as well?
Yeah, I can share. So here, let's see if I can show this up here. This was, I don't know how well that's going to show, but so for my current state, what I drew was something that we see happens a lot in the schools we're working with today, which is we only have so many resources, and so what we tend to do is run to where the crisis is and flow the resources to the crisis. So my picture, in case my beautiful art did not depict it fully, was that, you know, there's a lot of kids over here who are having feelings and do have needs, but it's the jumping up and down hair on fire situation that's getting the majority of the resources. And I think that's something that we see and feel today is where we all get stuck sometimes, is not seeing the early signs, because there's always something that we need to be in reactive mode on. And so then for my ideal state, what I tried to draw was something where you could have educators and staff and resources surrounding all of the kids, and we could be seeing and recognizing all of the different elements of mental health and all of the feelings, and being able to have all of that recognized and supported more proactively.
Thank you, Kate. And my picture, I don't know if folks can see, in the dream state, we have all of these different relationships, players, families, educators, administrators, all connected, feeling loved and supported and resilient so that they can thrive in whatever their hopes and dreams are. They have the tools to do that. They have the emotionally safe foundation to succeed. But then the current state is there's just like lots of silos, lots of separate different teams and people. And what we have to do is just bring everyone together. So also not, illustration is not my forte either, but hope we got that across.
Good
beautiful.
good thing we all have day jobs.
Well, thank you for sharing each of your different perspectives and drawings. And I'm seeing in the chat there was a note about accountability for students. If you have any other reactions to your drawings or reflections, please feel free to continue to share those. I'm seeing another one about the current state being more reactive to crisis, and what we need is system change and resources. So some alignment sounds like with the drawing you created, Kate. Great. For the sake of time, we are going to continue to our next section. You're going to hear us talk a lot about MTSS, or multi-tiered systems of support, today. Back in December, we did a webinar where we did a deep dive into this. If you're interested in learning a little bit more about this topic, we encourage going back. You can access that webinar from our sites. But we did want to provide a brief overview just to anchor this discussion in MTSS and what it is we are referring to when we talk about it. So MTSS is an evidence-based framework that schools and districts can leverage to tier interventions and supports for students based on their needs. This can be for academics, this can also be for behavioral outcomes. And what we are seeing at each of the different tiers is at tier 1, we're really referring to the universal level of support. So that is going to be the intervention and support that all students will receive. Now, if that isn't sufficient for some students and they need additional support, then we're looking at tier 2, which are the more targeted interventions. A lot of times this might look like small group work around these different targeted skill areas. And for students that might need some additional support, we see tier 3, or the more intensive individual level supports. Now, in an effective MTSS implementation, the key components that we'll see will include universal screening, so some form of assessment or assessing of all students to understand what their strengths and needs may be. We see evidence-based interventions across all tiers, so making sure that there's something in place for each level of support. We see ongoing progress monitoring, so a system or tools in place to evaluate how students are responding to different interventions. And we see data-based decision-making. So we see schools making decisions about what supports students need based on the data they have for those students. And those are some of the core pieces of the framework. Again, we could spend a lot more time on this, but we want to dive into this discussion and hear from our panelists. So as Move This World and Presence over the last couple of months have been working together, we've had this question of what does the current state of MTSS look like across the country for mental and behavioral health across schools? We wanted to learn a little bit more about this. So we've put together a survey back in December and collected as much data and information as we could from administrators, educators, counselors, social workers, school psychologists, and more from across 41 states, and collected some information about what different systems of support look like. Now, we will be sharing this information in a white paper following this webinar, but we wanted to share some of the high-level supports just to give you a sense of how we're anchoring this discussion and what some of the common themes that came out of that were. So what we learned is that there was consensus that mental wellness is critical for academic success, but there's lots of opportunities for the programs that are in place to continue to develop and grow. The majority of respondents agreed that mental health and emotional challenges negatively impacted students' abilities to learn. But we did find that nearly 60% of respondents agreed that their school or district currently had an MTSS framework in place to support mental and behavioral health outcomes of students, but that less than 40% felt that their schools had the necessary resources to actually align these MTSS supports effectively. We also found that less than 8% of respondents strongly agreed that their mental health systems of support were as robust as academic interventions. And we also learned about some of the perceived gaps that folks are seeing in their schools and districts with tools for progress monitoring and family and community engagement being some of those leading gaps, as well as educator resources and alignment across efforts. So with that in mind, we did want to take a moment to ask the audience a question, taking into consideration some of the challenges that schools face. What barriers does your school or district face when it comes to aligning these tiered supports for mental and behavioral health? And you should be able to select more than one answer in that. So we're seeing these results coming in, and they're changing quite a bit. Great, so we can share those results with the audience just so everyone can take a moment and see. So it looks like 63% have shared lack of funding and resources, 59% for limited access to mental health professionals, 26% for lack of common language, 53% for competing priorities, and 43% for siloed interventions and supports. So again, relatively split. Thank you all. So something positive that came out of the data that we collected was that there seems to be a clear path forward. Of educators that have integrated and aligned their tiered supports and resources, 81% have shared that they have seen positive outcomes. So that was something really encouraging that we were excited about. We also saw that 93% believed that alignment of efforts and approaches across tiers can result in more positive outcomes. So today, we want to make sure that everyone that is here can walk away with more clarity on how we can drive more alignment within MTSS. And spoiler alert, it's really all about implementing a connected, holistic program to serve all student needs. So we like to show this infinity graphic quite a lot because I think it does a great job at showing how all of these different interventions and supports can be working together rather than separately or working as siloed interventions, to ensure that students are supported holistically with a common language, and a community that is on the same page and communicating with one another. In terms of what this can look like in practice, as an example, we see that at the tier 1 level, we're building a common language around these proactive mental and behavioral health skills. At the tier 2 level, we're still using that same common language for students that need that additional practice and support. And if they need additional support for tier 3, we're making sure that the clinicians working with those students are also using that same common language. All the while, we're supporting staff members with their own well-being and wellness. And we're also supporting families with resources that build that common language and provide support for at-home practice. So in an ideal world, this is that continuum of care that is it made up of programs that are speaking to one another. And we'll talk a lot more about this as we hear from our panelists. So I'm going to stop my screen share at this point because we're going to hear from our panelists at this point. Again, if you were interested in some of the research and data that we very quickly went through, we will be sharing that information in the white paper where you can read a lot more about that. But we want to hear about the implication of this work from our panelists. So Jolise, we're going to start with you, if that's okay. We asked respondents in our survey to rate how aligned their district's mental health programs were within MTSS. How would you describe what this looks like across IDEA schools and what some of the challenges that you've encountered look and feel like?
Thank you so much for that question. So I definitely believe that our district's mental health program is robust, and I'll speak more about that later in terms of our trajectory of where we've been and where we are. We've been able to see our service delivery grow within the last 5 years in terms of our mental health supports that we're providing, and being able to also align towards tiered mental health supports as well. We've had, as y'all heard, over 2 million minutes and provided for direct student supports. And so Even with that, though, we still face challenges of, and exactly what people were voting on in the poll, of our school counselors and social workers having that protected time to serve as students because there's so much going on in the school setting, and truly leaders who may not be in those mental health roles understanding the importance of mental health and its impact on academics, specifically around protected time to be able to service those students and understanding the mental health role fully. I think that there's also just challenges with staffing and needing more school-based mental health staff members that are within ratio that we're experiencing, especially when we think about like funding cuts. Usually our mental health staff are sometimes the first to go. So when we think about the limitation in resource and staffing, those are definitely things that we continue to face challenges about. And I think that there's also just challenges in seeing MTSS as a whole student approach versus those siloed interpretations that we've been talking about, or solely academic, solely mental health, right? It really does encompass everything from tiered mental health services and approaches and academic support. So I think a lot of the challenges, we often silo ourselves and say, mental health team, student support services team, like you got it, academics team, you got it, instead of that co-collaboration where we can make greater impact.
Thank you for that. And in talking about these interventions being siloed or focused on just academics or just behavioral health, it seems like a common trend that we're seeing is that, yes, there might be an MTSS framework in place, but there is that lack of alignment across tiers. So Sarah, I'm curious if you can talk us through what some of the consequences of that lack of alignment are. And on the flip side, what are some of the benefits of having a more aligned framework?
Well, I'll start first with the benefits and the dream state. So when there is an aligned framework, these programs are reinforcing one another. We're all singing from the same song sheet, so to speak. So in tier 3, clinicians are able to reference strategies and skills that are introduced and practiced daily in tier 1. And then when the child is ready, can exit back out of that tier 3 environment into a tier 1 setting. And then in tier 2, we can dig deeper in some of these skills and topics through the common language and the framework that's practiced consistently and regularly in tier 1. So the benefit is that we are all reinforcing each other's work. We are working smarter, not harder. These programs are aligned philosophically, therapeutically, and also operationally. It's just easier and truly stickier. The disadvantage is I think it's a lot of wasted time, energy, and resources. So we have found in some of our districts where we didn't know what was happening in tier 3, and there were really missed opportunities for us to both get kids the more clinical care that they need, and also for those clinicians to reference what's happening in tier 1. So it's kind of extra work for everybody. So the ideal is that there is alignment across MTSS and everyone can reinforce the work happening and all move toward the same goals so that kids can get the referrals and get the care they need, and then also exit back appropriately into the tier 1 setting.
Thank you. And on that note of being more aligned, a question for Kate. Can you share how Presence and Move This World are working together to support schools to ensure that students are receiving that more seamless support across each of the tiers?
Yes, definitely. So when we at Present started working with Move This World, like it came from conversations we were having about recognizing some of these gaps or areas that needed to be bridged in what students were experiencing as they moved between the tiers. And what we have seen from the presence perspective is, we have teams of clinicians, we have school psychologists, counselors, social workers, various mental health and behavioral professionals who are often engaging with a student because we've been brought in to support a tier 3 need. And when that happens without connectedness or without context, it is, as Sarah was saying, it takes more work, more exploration to try to understand what's the broader team that's been working with this child. What are the target needs? What's the language? What's the curriculum that's been experienced? Can we match that in the work we're doing? It's going to take a lot of setup points every time if you're bringing in these different elements in a disconnected way. So we really started from, well, what if we connect it and bring it all together from the start? And what we see is that it allows us, when one of our clinicians is being brought in, they already will know what some of that language, what the curriculum approach, what's the approach of the team that has been engaging with this child through the tier 1 and tier 2 supports, so that we can come in more effectively and have a better chance of getting right to meeting the need. So I think it's really beneficial to the students, we think, for sure, but also really all of the educators who are working in this environment. Everyone has a lot going on, is very stretched for time. We're all looking for ways to have as much of that time be directed to the interactions that are going to support the students, and to have to spend less time on figuring out and reconnecting some of those pieces along the way. So it's really like when we talk about alignment, it's really connectedness, and trying to carry an approach through all the way to whatever the level of the intervention is that's going to be needed.
Great, thank you for that. So there's a lot of, as we've been hearing and discussing, in practice, there's a lot that goes into building and maintaining an MTSS framework, especially, Jolise, for a district like IDEA that's working across more than one state. You're working in Ohio, Texas, Louisiana, Florida. I'm curious if you can share what aspects of this you have found success with, or where you think IDEA has excelled in this space.
I appreciate that question. Coming into the organization, so I started my journey at IDEA in 2019. That's when we started hiring more mental health professionals within our school district at that time. We didn't yet have a mental health type of program that was tiered. We weren't in partnership yet with Move This World. We didn't really have anything. And so we had not yet had those partnerships and truly established like those foundational mechanisms, which include, tiered mental health supports, having a tier 1 program at all, having a system to even document mental health services, talking about what tiered support looks like. And so we have truly been on a journey since then. And while we still have work to do, I am proud of where we are today. Specifically, we have the highest Move This World implementation across our district that we've ever had in the history of implementing the program. We've been with Move This World since 2020, and over the course of the years, we've been able to create buy-in with district leaders and other individuals to make tier 1 of implementation of Move This World a priority, which I really appreciate. This year we're at 79%, to throw some data out there, but in years past we were at 60%, the year prior 30%. So every single year we have grown across the district and all of our campuses to be able to at least get a foundational tier 1, which then led towards like establishing that tier 2, tier 3 framework for our district. I am grateful for my position as well, because I think progress monitoring and data evaluation is just super important to continue to advocate for our students, our staff, our families, for those additional supports. And that's where we got the opportunity, or were able to push towards getting Move This World and creating a partnership with you all, as well as even now creating the partnership with Presence for additional tier 3. All of that has been possible through the data evaluation and the progress monitoring aspects, which I think is a huge importance of speaking district leaders' language to be able to talk through what is the data telling us in terms of what students need, what families need. So it would not be possible without the hard work of everyone who has been involved throughout this entire process within mental health to definitely support our students and our families.
Thank you for sharing. IDEA has done some incredible work that we've seen over the years with reaching all of your students and really strengthening all that is being done at the tier 1 level. And tier 2 and tier 3 as well. But we know we've spent a lot of time with that foundational piece with your team. So in thinking about some of the gaps that were identified as perceived gaps in MTSS related resources in the survey, we saw that there was a higher percentage of respondents that identified tier 2 and tier 3 related resources as a gap as compared to tier 1. This question is for you, Kate. What are some of the challenges that your team has seen when it comes to schools being able to ensure that there's access to more intensive interventions for students?
I think when we're looking at what's happening in the tier 3 or even the tier 2, a lot of it really is about getting the right staff in place and grappling with shortages. And there's shortages, of course, in a lot of places across schools today. And we definitely see it in some of these areas. I think what's happening when you're getting into tier 2 and certainly tier 3, you need more and more specialization. And you need to, make sure that you've got the right expert in place for what that child needs. And when you don't, when there's gaps there, it's really a burden on the staff as a whole and on the others who are part of that education program when they're trying to figure out how to provide some of that they might not feel as prepared for as one of the experts. And so a lot of what we're trying to help with from our lens is figuring out, where can we help bring in and supplement that on-site staff so that there's coverage and making sure that we get it right in terms of the expertise. When do we need to bring in a school psychologist? When do we need to bring in a social worker and so on? And trying to get really targeted in the staffing coverage so that we have overall the right level of expertise for what needs to be done. I think, it came up in the poll that you did earlier, and lack of staffing shortage, lack of maybe the right staff in the right place. These are very real obstacles that everyone's facing that I think just start to feel more and more acute as you get into that tier 3.
Thank you for sharing that. Sarah, this shifting gears a little bit. When we looked at the drawings that you had created, something that you identified in your dream and ideal state was this connectedness between the community and family. This is also something that was identified as a large gap in systems of support for schools and districts. How can organizations like Move This World or Presence support schools with that family and community engagement piece?
Well, we all know that families are critical partners to this success, and making sure that they feel engaged and that they have the tools and resources to reinforce this work and this practice at home, because mental health doesn't end at the walls of the building. It continues. And so I was even thinking about this, Jolise, as you were talking about the widespread adoption, and that 70%, or I think I've seen data recently that many of your buildings have 90% of teachers using this, daily tier 1 practice to meet your expectations of regular, consistent implementation. I think a big piece of that in schools and at home is ease of use. As a mom of three, I have limited time. I can only pay attention to so much. And so how do we deliver this practice, one, in ways that are engaging, that are fun, that are participatory, that stick, and that also are short form and accessible, because we all are just doing so much and it's information overload. So how do we give families tools that they can use to reinforce these skills and practice and build emotional resiliency on the way to soccer practice, over bath time, over breakfast, over dinner, conversation starters, again, in the car, similarly, that they're using those same practices that are happening in the building from teachers, from mental health professionals, from leaders. There's just ongoing practice in whatever environment you're in. And then how do we invite families to be partners in this so they feel emotionally connected to our learning communities as well, and they're excited about this and they want to come on site and participate in these gatherings and in these workshops and learn about what's happening and further unpack and explore and deepen in the home what we're doing in the school. So I think it's really critical that it's accessible, that it's fun, that it's engaging, and that it isn't a burden, but it's really an extension of teaching, learning, and living, parenting and living.
I love the accessibility piece and also just making sure that this feels fun and engaging for families. I think it's key for students in particular. So thank you for sharing that piece. Jolise, one thing that we brought up on the slides previously that really struck me in reviewing the survey results was the small number of people that reported that their MTSS programs for mental health were as robust as academics. It was only 8% that strongly agreed. How do you think school and district leaders can look to what they have done for academics to improve their multi-tiered systems of support for mental and behavioral health?
I appreciate that question. Thank you. And I think to note, while we have a strong mental health programming, there's always still work to do just overall. I do believe that school districts need to work in strong collaboration with both the academic and mental health stakeholders. I think oftentimes we see them as two different worlds, and they're not. A lot of times we can take what we do for academics that translates into the mental health, behavioral health aspects. One can't exist without the other, and those processes and procedures really go hand in hand. I do think it's important to recognize that often, and it was in the data that you shared as well, that student academic outcomes do stem from their need of mental health supports. They stem from their past traumas, their exposures to adverse experiences, or just overall mental health needs. And oftentimes we spend so much time focusing on the academic piece and getting them towards, I know that there's a lot of pressure with funding with some states and with the aspects of like the letter grade for the school, and we don't focus on the why behind what's happening. So I think the more that we continue to just work in collaboration and move away, we've talked about this continuously today, like the siloed work, it's going to create, the best benefits. And I think it's also just important, with Idea Public Schools, we work in multiple states. And so the aspects of understanding policy and the differentials between states is really, really important. And that's something that we do at the national level to truly understand and create that alignment. So while it meets, state requirements, right, we're also doing what's best for our students and our families.
Thank you for that piece. And just the nuances of working across multiple states is really something that I think is fascinating because there are so many different policies and processes I'm sure that your team is keeping on top of across each different state. So something exciting that we saw in the survey results, again, is that there does seem to be this clear path forward, this momentum towards aligning supports and a desire to get to that place where interventions are speaking to one another and supports are aligned across each tier. Sarah or Kate, would you be able to give really explicit advice to schools on what steps they can take to effectively align their supports across tiers to support mental and behavioral health?
Do you want me to go first? Do you want to go first? I'll go. I'll give some specifics on some of the areas that we know so well, and then I want to hear, Sarah, what you think too. I would say from our perspective at Presence, I think a couple of things that I really think are important to map out from the start when designing these connected programs are to have first of all, plan to train everyone, right? There has to be really, really consistent training and clarity on what we want our teams to do, what the protocols are for handoffs, what we want to be looking for in early warning signs. Some of those areas, I think it's about, real definition and training on that so that we know that when there are going to be, there's identification, when there's an intervention, when there's a handoff between them, we all know what the protocol is. The other area that I would speak to is really when you want to make sure you're resourced at all levels, right? And the area that we know so well at Presence is often in bringing in some of the experts, some of the specialists, the mental health professionals and behavioral professionals to plan for that ahead of time and to really decide and define for your program where you want to leverage teletherapy and a teletherapy resource in particular. We see it done differently, and it depends on, it's a collaboration with your approach on site and with your on-site teams and deciding, where will we choose to leverage those resources, whether it's remote evaluations, whether it's teletherapy. I think deciding really how you want to do it and thinking of it as incorporated into the whole we see where that leads to, that cohesive program that everyone is aiming for.
It's funny because we didn't compare notes at all prior to this. But Kate, I think that starting with the adults is critical. And it's interesting because someone put in the chat, tell us more about the staff wellness programs. And it's so important that the adults in the community can model these pro-social behaviors, can really authentically be leaders, can be ambassadors of this work, to truly have top down, bottom up, sideways modeling of emotional connectedness and resiliency. So I think leading with the adults is critical. Also, some strategic direction and implementation and common language. We work with so many districts where this is fragmented at every level. It's fragmented across tier 1, tier 2, and tier 3. Yes, but it's also fragmented within tier 1, where buildings are all using different programs, speaking different languages. I mean, Jolie's, her leadership, having 90,000 students really practicing in the same way makes it easier to monitor fidelity of implementation. It makes it easier to evaluate efficacy. And so when there is lack of alignment and it is disjointed, it makes it makes it harder to manage, and it makes it harder to monitor efficacy and consistency. So I think real strategic direction and clarity, and then consistency is key.
And I think the common language piece, I think I saw a question or a comment somewhere about like, what are we reinforcing? And that is the piece of this that we're reinforcing. We're reinforcing that common language to get everyone on the same page and ensure that students are being supported with the same common language, the same supports, no matter who they're interacting with. So thank you both for sharing your perspectives on that one. Building off of this, Jolise, from your perspective, what roles can everyone within a district play to work towards creating this more aligned system of support for mental and behavioral health?
Thank you for this question. It's a question I could go all day on about, but I'm going to try to be very succinct. I think just creating aligned systems of support really just requires that collective effort across all levels of a district, and each role has such a critical role in which they play, each district role. And so when I think about just district leadership, and I oftentimes leverage this perspective as my own advocacy. First, when we think of just the district leadership, our superintendents, our directors, our executive teams, we have to have that prioritization of mental health as a core component of student success. And this means the integration of mental health initiatives into strategic plans, allocating funding and advocacy for that funding for necessary resources, and looking towards our policies. Are they equity driven? Are they trauma informed? I think when we go down to the school level, the school leaders, our principals, our assistant principals, any other roles that I know every district could look different, deans, if you have those, it's truly essential in just creating a culture. They're a pivotal role in creating that school culture and climate that supports student well-being. When we think about how they can do this, it's embedding the social emotional learning programming into school structures. It's ensuring effective implementation of interventions and fostering that collaboration between teachers, between families, between support teams. And I think also our student support teams as well, our social workers, our counselors, our psychologists, our mental health professionals on campuses, they truly are just the heart, the glue, the front lines of the, intervention. And so providing that counseling and support is truly important, the training of staff, connection of students to the appropriate resources. Our families, our community partners, they play a role as well. You all with us, it's such a vital role to make sure that we can engage our families in school initiatives, but that we can also ensure that support just extends beyond the school building. And so I think when we look at a district, it's important to truly understand that mental health isn't just the responsibility of support staff. It is the responsibility of every person at every level in the district to truly just work together, be collaborative. And when we're able to do this, we truly are supporting the whole child. And that's the mission that we all want. We just have to create the collaboration to get there.
Beautiful. Thank you for painting that picture for us. With the 5 minutes that we have left, we'd love to dive into some additional questions. But I think that this discussion, it was just so great to hear from each of your perspectives, what this can look like in that dream and ideal state. So thank you to our panelists. I'm seeing, I saw a question in the chat that I wanted to raise to this group. How do you keep schools and districts from underestimating the work and time required to put in a comprehensive and systematic developmental approach to Tier 1? That's a big piece, but I'm curious if any of you have thoughts on that.
I want to hear from Jolise for that, because Jolise is doing it at scale for 90,000 students across, 147 buildings. So Jolise, I want to hear from you.
Yes, I think, or just knowing the journey that we've been on, right? A lot of times when we think about Tier 1 and look at it from a place of like all of our schools, our district, because of how large we are, started with a pilot. We didn't have a necessary requirement at this point. I was in the campus level. It was like, hey, we got this curriculum, we're going to pilot it. And then after we were able to yield results, who's using it? Is it being implemented? I don't even think we were tracking data at that point. We're just like, hey, we want to use something and start off with that. With the piloted schools. And then as it increased, like we were able to get the data to evaluate and truly name like what schools are using it, what are not, how do we do buy-in? I think I've been on so many talking tours across my district of like the importance. I've done town halls. I've met with senior leaders. So when we think about like creating or implementing a program, it's creating the buy-in first, right? Like, why is this important? Why do we need it? What is our goal with this? And so for us, it started off as like a mental health vision. Where do we want to be 3 years from now? What are our priorities? It started with the piloting and just like the touring of going around to leadership and creating that buy-in. I think that has just created a lasting impact. We're not perfect. I'm not saying that and staying on this call. It has had to continue with the buy-in. I continue to buy leaders into the process towards that advocacy. So my advice would be like, having a plan in place, like where are you trying to head to? Can y'all pilot something to start off, right? To be able to understand how to systematize it and go from there. That could create and turn into leverage and utilization at across your district.
Well, thank you, Jolise. I know that we are almost up on time. So I just want to thank each of our panelist speakers once again for sharing your expertise, your perspectives, your ideas. I hope for those of you that joined us, you found this conversation to be really helpful as you think about that dream and ideal state of mental and behavioral health in your school communities. So thank you everyone for joining us. We will be sharing the white paper and the recording and a follow-up email that you can expect in the coming days. And we're going to just close with one final collective breath. So I invite everyone to either close your eyes or cast your gaze towards the ground. And we're going to close with this breath that we will take for this group right here of both our panelists and our audience, everyone that has joined us, and the collective impact that we can have on supporting students, families, and schools across the country, and strengthening the well-being of our communities. We'll take a deep breath in and out. Thank you so much, everyone. I hope you have a great rest of your Thursday afternoon. We hope to see you soon.